Three, two.
Good afternoon, everyone. It's a true pleasure to be able to be here today, and I appreciate everyone for taking time to join us. I would like to preface with the title of this session. I will be sharing the work United Healthcare is both invested in and committed to doing in Arizona communities around affordable housing and our most complex population, and take you on the journey. I am Nellie Nakui, and I have been honored and humbled to be able to lead housing and health initiatives along with other social determinants of health initiatives in the state of Arizona for the last 5 years. At the end of this presentation, I will also provide a robust list of affordable housing resources that is ongoing list that we continue to add community partners to in the Hope and Help Room or on the website. A segment of healthcare consumers, those who live with myriad complexities, such as chronic medical conditions, behavioral health issues, and social disparities, such as homelessness, seek help by cycling through emergency rooms, hospitals, and nursing facilities. They seldom see improved outcomes while their cost of care accumulates at the expense of state agencies and government-funded health plans. The drivers for this top 1% of the diverse and multidimensional are diverse and multidimensional, much like the consumers themselves, who tend to be bucketed as a singular problem in need of a common solution. We know that while there are commonalities among persistent frequent utilizers, like unaddressed trauma and serious behavioral health issues, it takes a deep understanding of the root causes of an individual's whole health situation and an advanced care philosophy to provide better care at lower cost and ultimately break the utilization cycle. Most of what affects our health and wellness has little to do with actual health care. Our health is affected by a myriad of factors, like where we live, what we eat, our financial situations, and our relationships, our social determinants. As a result, the healthcare delivery system and the care it provides needs to look different. Some factors are here on the slide. As we know it, every individual is unique and has a unique story. In 2016, a trend was discovered that guided our vision. Our homeless population utilizing our emergency rooms average of 9 times more than our average. What we have found as the key to success in transforming lives through the housing first care model is to first establish trust, which can take time. And trust is built using a trauma-informed approach. You don't just provide a person experiencing homelessness a place to stay and think you've checked the box on homelessness. They will be back on the streets within weeks. You have to provide the right level of support services at the right time. For housing and plus health initiatives, that's one way we go beyond what's typically considered traditional healthcare. We deliver in a specialized and integrated wraparound care, social, medical, behavioral health, and addiction recovery. Our support is high touch and one-to-one after they've moved into their apartment. We connect members with the right quality community resources with experience in caring for complex needs. We enable and empower members to become independent. This is only the beginning of their journey to better whole person health. Simply put, our team's goals are to improve outcomes for our patients, also community and state members not adequately served by traditional healthcare delivery system, reduce hospital admissions and readmissions, reduce emergency room and inpatient utilization, increase pharmacy and outpatient utilization, decrease total cost of care, and improving members' quality of life. Collaborating to deliver better complex care, a micro-curated network of trusted partners is critical. It allows health plans, vendors, and members access to specific specialists, providers, and organizations that are not only experts in their field, but aligned with United Healthcare's care philosophy. These identified organizations and individuals recognize the field of complex care, understand the special needs of the population we serve, and are invested in the health and improved quality of life of the community's most vulnerable. Health plan leads leverage existing relationships with local partners known to be aligned in care delivery, such as hospital systems and organizations that support people in experiencing homelessness. Designed to fill medical and social gaps in care, prioritize health providers according to quality and availability of services, as well as focus on utilization management and align with trauma-informed care philosophy. Partnered with specialty care, food, and clothing assistance, legal assistance, education, and occupational training programs. Prioritizing social service organizations by accessibility in regards to geographic location, proximity to public transit, and length of time to obtain services needed. We develop and verify strength of the network in weekly collaborative huddles. It takes a village, and a collaborative partnership in the community are so important. Select members receive targeted interventions. They move into set-aside apartments and are provided intensive wraparound care to medically stabilize them and control healthcare utilization. Housing Plus Health is largely based on the care model called Housing First, an evidence-based approach that connects people experiencing homelessness to housing without preconditions and barriers to entry. The simple notion that we'll house you first and we'll take you as you are. Housing First is a person-centered, trauma-informed approach comprised of 5 core elements: identification, stabilization, goal setting, working goals, and self-sufficiency. Housing First has been proven to reduce total cost of care and improve health outcomes by relieving the care delivery system of the burden caused by people experiencing homelessness who aren't getting any healthier despite their high utilization. The data has proven our Housing First Plus initiatives lead to lowering healthcare costs and better overall whole person health outcomes. We have initiatives across 15 states currently and have invested $21 million in Arizona alone in partnership with Chicanos por la Causa. In closing, United Healthcare is committed to leveraging our efforts to be a partner in the community in tackling the homeless crisis in the state, which is also why United Healthcare and other healthcare leaders have created the Home Matters Fund, which is helping to get more affordable housing options open quickly across the state. In the first round of grants, $1.2 million in funds have supported 167 new units of affordable housing open across the state. You might be asking yourself how you can utilize these resources. All 7 managed care organizations have housing coordinators that can assist you in efforts. I've listed United Healthcare's housing coordinator here on the screen, and as I've mentioned at the beginning of the presentation, I'll be happy to provide our ongoing resource list in the Hope and Help room for your reference or on the website. Thank you so much for your time today, and we'll open it up for questions now.
All right, if anyone has a question, they can ask it now. I noticed, Nellie, there was Aaron's email. Can you say that out loud, that email address for Aaron?
Sure, it's Aaron_Lapalm at unitedhealthcare.com.
Okay, so it's the full unitedhealthcare.com?
It's uhc.com.
Right, okay. On the slide ahead, uh.com. Okay. All right. Any questions, anyone? All right. This has been an awesome presentation. We are in our second of my second, but hopefully you guys got a lot of great events today. We have a board member, Chiquita Taylor. Did you want to?
Yes, Nellie, thank you again for such an informative presentation. Really appreciate your time. And so I just want to remind everyone that this presentation, as well as All others presented throughout this 3-day event will be available at the easthillstream.com/FIPCO website. And the recordings will be available in the upcoming days. And you can just select the presentation you're interested in, and the recording will be there for you to view. We also want to remind you or ask you that you look out for an email with a survey. We really appreciate your feedback about the event, and we want to know how we can do better. So I look forward to hearing from you and really appreciate you attending this fair.
All right. Thank you. Thank you, Nellie, for all your assistance. Looking forward to seeing you guys throughout the fair.